Hey fam, Dr. Sam here with the second video of the acne video series. The point of this video is to provide you guys with a basic level of understanding as far as the treatment approaches are concerned, but more importantly, an understanding for the rationale for the different treatment choices. Acne comes about through 3 steps. The first step is a clogging of the skin pores. The second step is an infection supported by sebum because the bacteria eats the sebum. And third is an inflammatory cascade that's triggered by the infection. So we keep these 3 things in mind when we're trying to figure out an appropriate strategy to treat. First is the clogging of the skin pores. The skin pores are clogged by dirt, dead skin cells, and excess sebum production. As far as dirt is concerned, of course, I recommend washing your face morning and evening. I recommend using what's called a synthetic detergent. I dissuade you from using soap. The reason for that is that soap's pH level, pH is a level of, it's a measurement of acidity. Low pH is more acidic, high pH is more basic. So soap's pH level and the skin's pH level do not coincide, and so soap ends up being very harsh on the skin, it's very drying on the skin. Whereas if you use a synthetic detergent, its pH level and the pH level of the skin coincide. So I would suggest using a synthetic detergent twice a day, morning and evening. The second thing that clogs pores is dead skin cells, and that's why exfoliation is really important. When we exfoliate our skin, we're removing the dead skin cells, and so they're not going to be clogging the pores. And the third thing is excess sebum production. The sebaceous glands are receptive to a few things. First, excess dryness. So if you recall, the sebum is your body or your skin's natural moisturizer. It's a fatty, oily substance. And so if our skin is very, very dry, as a compensatory mechanism, the body will increase production of sebum. So it's really important to keep our skin really well moisturized. So when we wash our faces morning and evening, we have to use a really good moisturizer after. Especially in the morning time, I would suggest using a moisturizer that's fortified with SPF to protect our skin from the damaging effect of UV light rays. When individuals suffer from acne, their sort of knee-jerk reaction is to wash their faces like 8 times a day. Yes, that does a good job in terms of removing the dirt, but washing your face that frequently is going to cause your skin to become very, very dry. As a result of that, you're actually doing more harm because your body's going to increase sebum production. So stick to washing your face twice a day, use a synthetic detergent, and then use a really good moisturizer. The other thing that will increase sebum production is stress. And so it's really important to kind of manage our levels of stress, exercise, meditate, all of those things. The third thing that increases sebum production is the sebaceous glands are very sensitive to androgens. Androgens, the way you want to think about them, are basically like male hormone derivatives. So we want to generally lower the level of androgen activity in the patient. Now, for males, that may not be possible because they do have a good amount of testosterone and it's important for their physiology. But for female patients, what we can do is we can prescribe oral contraceptives or birth control pills. Birth control pills are comprised of estrogen and progesterone, which will fight against the male hormone, aka the androgens, which will improve the acne. The other thing that we can do is we can prescribe medications that have a side effect of anti-androgenic activity, such as spironolactone, which is actually a blood pressure medication, but it can also reduce levels of androgen. Okay, so that's how we sort of combat the clogging of the skin pores. The second thing is the infection. So how we reduce the levels of infection is we can try our level best to kind of kill off that Cutibacterium acnes bacteria. How we do that is we can use topical antibiotics, we can use oral antibiotics. There are certain bactericidal creams such as benzoyl peroxide, acetic acid. All of those things can kind of decrease the bacterial load, which will decrease the likelihood of generating an infective process. The third thing that we want to do is we want to reduce inflammation. And so often the creams that we use, the bactericidal creams such as benzoyl peroxide, those types of creams are also anti-inflammatory creams, so we can use those to also reduce the inflammation, so you kind of get a double whammy effect. The other thing that we can use is we can use vitamin A derivatives, so topical retinoid creams that will reduce inflammation, and certainly that will also reduce sebum production. The other medication that we use is sort of like a big gun, is another vitamin A derivative, and it's an oral medication called isotretinoin, and now that medication also reduces inflammation, works really, really well for acne, especially in treatment-resistant acne. However, that medication has a number of side effects and can be very, very toxic to a developing fetus. So those are the things that sort of keep in mind. But generally, the approach is to reduce the pores from being clogged, to reduce the bacterial load, to reduce sebum production, and to reduce inflammation. If you have any questions, please email me at askdrsammd@gmail.com. And before I go, what do you call a pig that does karate? A pork chop!